Behind me is Miami. We're very international, and international would be national or statewide as Florida. In any case, this is Dr. Nucci Medical in Tampa. Today's Coffee Talk is on. I don't know if there's anyone here. Elsie is in the chat room. On re-herniations. How common are they? We're talking really about low back. I mean, we can talk about the neck too, maybe at the end. It's not as clear in the neck as it is in the back. When I say clear, there's not as many studies out there. There's not as much literature on it. My experience has been it's less common in the neck. It's significantly less common than the low back. However, when you have disc surgery, we're talking about having a discectomy, going in and you have a disc herniation and the surgeon removes the disc herniation. There's multiple different ways to do it, but putting that aside, they remove that herniation. Now, just as an analogy, discs, I actually have my model here. Discs are soft on the inside and hard on the outside. This is a bigger model than actual reality. So here is your disc. My pen. Here is the disc, right? That's the cushion, and there are the bones in the low back. There are the blocks, right? This is the back of the spine here, and over here are the nerves that are coming out into the legs. You can have, like I said, you can have a herniation. There you go. There's a herniation. And there's a recurrent herniation. Okay. In any case, a herniation, the surgeon removes that one way or the other. But then it recurs. It pops out again. And it causes pain again. How common, really is that? Well, it's interesting. The literature is somewhat non-specific. When I think of a re-herniation of a previous herniation, in my mind, it would be the same place, right? You get a herniation and then it comes out the same place again. If it comes out on the other side, if it's, in other words, if the herniation comes out over here one time, you remove it, and the next time it comes out over there, it's really not a recurrent herniation because it's in a different place on the other side of the spine. However, in the literature, that's considered a recurrent herniation, even though it's a different side. And sometimes they say a recurrent herniation is anywhere, right? I mean, it's a disc at one level herniation, and somewhere else in the spine, you have another herniation. It's a recurrent herniation. That's a little less common, but I've seen that also. So you have to be fairly careful when you talk about recurrent or repeat herniations, recurrent, repeat herniations. In my mind, it's the same place and at the same level, same place. So how common is that? Now, the literature actually goes in different directions in this. It's somewhere between maybe 7 or 8%, and maybe up to 15, even high as 20% in some studies. So it's fairly common that you would have a re-herniation. My guess is it's probably, when you look at all those factors, you take everything, it's probably about 10%. 1 in 10 is a recurrent herniation. So, it's a problem. Now, how to take care of it, you go in different ways. You operate again, you remove it, but there's other things that you can do. As a matter of fact, there are, some new techniques and new instruments where they essentially plug the hole with like a cork. It's not really a cork. It's a implant that's gone through the FDA, and they try to plug the hole. And there's some success with that. They got to plug the hole. Of course, it doesn't have herniations come out somewhere else, but you maybe plug that particular hole. There may be some success there. There is some literature that suggests that the smaller ones are more likely to recur than the bigger ones. Interestingly enough, for whatever reason, this little ones, you take it out, comes out again. A big one, maybe all the loose material has now come out with a big one, and the rest is well fixed. Maybe that's the reason. But smaller herniations are more likely to re-herniate than bigger herniations, interestingly. I mentioned about the neck. The neck is less common. The discs in the neck are smaller. The back, it's not quite this big in the back, right? Smaller than that, but that's maybe blown up about 20%. In the neck, it's quite tiny. So often in the neck, when you have a disc herniation, you remove the entire disc and fuse the spine in one way or the other. So there is no disc to re-herniate. It's not there. It's also smaller, and so when you're removing the disc herniation, if you remove just the disc herniation, you're removing a fair amount of the disc proportionally, and maybe that's why. It's less common, at least in my opinion, in the cervical spine. But it's the low back where we're talking abdominally about recurrent, herniations. And I know patients, have had pain, they had their surgery, and they're doing fine, and 6 to 8 weeks later, they're like, oh, it came back. And it can. And patients also ask me, is there something I can do? Not really. You should return to activities as tolerated. Try to return to all your activities over the course of 2, 3, 6 weeks. Maybe you need rehab, but you really should go back to your activities. Using the spine correctly, appropriately, and the way you've used it before, pretty much, is probably the best way to prevent another herniation. Is it's often from an abnormal motion, a twisting motion, something you're not used to doing. I dropped something on the floor. Oh, I got a herniation. Activities you normally do tend not to be as common, but they can. Point being that return to activities. I'm sort of off topic a little bit, but that's sort of something that people do ask when we talk about, recurrent herniation. So certainly if you have a herniation, that is one of the things you want to ask your surgeon if indeed it's something that needs to be surgically treated or an option to surgically treat it. You should ask, hey, recurrent herniations, how common is it? Their experience might be a little bit different. As I said, literature tends to run the gambit a bit. So their experience may be a little different than that. Maybe they say 9% or 12% or whatever they think. But you should ask them, what do I do? What would happen if, I had a re-herniation? What do you do? And I'll tell you briefly, generally you treat it like another herniation. If there is no other neurological symptoms, you treat it like a new herniation. You treat it conservatively first, and then ultimately you may need to operate on it. So that's another coffee talk. But recurrent herniations, they're more common than we would like, and there's no great answer on how to prevent it. There is some instrumentation that may do something, but it does happen in the low back particularly. And I think that's it. I think I may have rambled a little bit. I was in surgery, so hair's a little messy and shaved. It was a surgery, so maybe that's why I'm going a little quicker to make sure everything's done efficiently. In any case, let's see. Are there any questions? Well, actually, I went for 70 minutes. Nobody has any. Oh, there's a question. I can't read. Okay, here we go. Here we go. When a patient had a fusion done, there was no herniation, and they cannot re-herniate the disc. That's true. I just said. But how common is it develop a herniation above or below the fusion? Well, that's a great question, actually. And they're right. If you have a fusion, either the low back or even the neck, you remove the whole disc, or if you're fusing it so the disc doesn't move anymore, right? So it can't bend, and so it can't do this kind of thing. The spine is fused. Even if some of the disc remains, it doesn't move. So you need some motion in order to re-herniate. So if it's fused, it's not going to re-herniate. Generally, that's correct. If you remove the whole disc, it's definitely not going to re-herniate because there's no disc. But the question really is, if you fuse the spine, one level fused, above or below it, are you likely to get another herniation? The answer is it makes sense that it would more likely happen. There's not a lot of literature out there to say one way or the other, but the thought is if one level is fused, the other levels above and below would need to move more in order to make up for the lost motion of that one level when your spine moves. And that increased motion, that increased stress can cause another herniation as that disc is twisted more than it would be normally, or maybe even moving abnormally because the spine below it or above it is fused. There is no great literature that I'm aware of to say that. It does make sense. There is literature, and I can attest to this in my own experience, that the disc above and below is more likely to degenerate. In other words, it's more likely to get arthritic. One of the reasons, at least theoretically, is it's moving more. You move it more, you wear it out faster, and so on. There's probably more going on than just that, but that's certainly part of it. So degeneration, yes. Re-herniation seems it would go along with that, so I'd have to say it is more likely. I can't give a number for it. I can give you a number for arthritis. It's like 20-30%, but the re-herniation, not necessarily there, and it's probably not that high either. But it is a concern, and something else you can ask your surgeon if they have any other experiences than I do. That's a great question. There's another question. On cue. Look at that. All right, let's see. I can read this. Is a re-herniation different in the neck? Okay, so we're talking a little bit about the neck. Well, the neck is different anatomy than the low back. It's really a different animal. I tell patients it's different. If you did an injection in your low back, and it might actually work in your neck or not work. There's no real correspondence. It's a very different anatomy. I don't have any models of the cervical spine. As I mentioned earlier, usually when you're doing a cervical disc surgery, most of the time you're removing the entire disc, so there's nothing to herniate. If you're removing part of the disc, again, the disc that's remaining can re-herniate. Again, not a lot of literature on it. In my opinion, it's less common in the neck, and I'd say again, go back to normal activities after you rehabilitate. So there is a difference. I think it's less common, but it does happen. I've seen it happen, but it is fortunately less common. So there you go. That's that. They're wonderful questions today, and that may be all of our questions for the day here. But what else can I say about the re-herniations? They happen, and we don't have a fantastic way of treating. I will say one of the things. We have a few minutes here. There's a little bit of controversy about herniations. People have been aware of re-herniations for a long time. This is like it just happened a couple years ago. And I think it was the 1960s, way back, if you had a low back disc herniation, they would fuse the spine. They would fuse it. And the thought process is, it's going to re-herniate. Why we just have to avoid that and fuse it? Well, that would do it, pretty much do that. But, fusions are a big surgery. And nowadays, the disc surgery, microscopic, endoscopic, very small. So it's a vast difference. So it's an overkill. It's an overkill. So we don't do that anymore. The question would be, if you got a second herniation, all things being equal, should you just operate again and remove the herniation, or should you remove the entire disc? There is, and fuse the spine. I mean, there's more anatomy. There's sort of different patients have different problems and arthritis and on. But from a high level, generally you remove the herniation again. You do it a second time. You remove it most of the time. A little controversy. Some other doctors might feel differently. If it happens a third time, I think we all agree we're going to be fusing the spine at that point. It's happened a fourth time. So that's probably where it's going with that. But it's also a good question to ask your surgeon. I had a herniation. Take it out again. How likely is it to happen a third? There is no great literature on how likely it is to happen a third time. I think again, it's likely less common than the first time. Partly because there's less disc there, probably. But at least in my experience, it's less common, and what at least I understand from reading colleagues, it's a less common problem. And there you go. Well, I think we may have done it. So thank you. Happy New Year to all. This is our last coffee talk of the year. But there's next year. So we plan to continue to do these. Please continue to send questions, and we can cover those different topics. If it's a very big topic, then we may have to do more of a podcast or something on that. But for smaller topics, we can talk about it. Obviously, when you talk about a small topic, even today, it leads into other questions and other things which can't be covered in a 10, 15 minutes. But it does give us ideas for other talks. It may give you ideas. Anyway, this is Dr. Nucci from Nucci Medical. Thank you for joining us for our final coffee talk of the year.